What we need is not more medication, but more education, because the best prescription is knowledge. This is Exposé coming to you live from Lagos, Nigeria, every Monday on Instagram, YouTube, and Facebook simultaneously. I'm your regular host, Tony Akinyemi. Don't forget, what we need is not more medication, but more education, because the best prescription is knowledge. Hello and welcome to Exposé. I'm your regular host, Tony Akinyemi, and it's my joy and pleasure today to start yet another series on Exposé. By the way, Exposé holds every Monday at 8 p.m. West African time or Nigerian time. Every Monday at 8 p.m. simultaneously on Facebook and YouTube. And we want to invite you to subscribe to our channel. Also click on the notification bell so that whenever we are live, your device will notify you. And after watching this episode, we also request of you to send the video to your friends and family, to everybody on your contact list, so they too can be blessed. This series will be based on defeating diabetes naturally. And it's going to be based on the book that my daughter and I co-authored. Sometimes in 2019, we co-authored a book titled Defeating Diabetes Naturally. And my daughter is a medical doctor, and I am a nutritionist. So we collaborated together to author that book. And I encourage you to get a copy of the book, because I'll be teaching from the book in this series. You will find it on Amazon.com, and you can also buy hard copies from our bookshop, the Shepherd Stores Limited, at our bookstore number 18 Shogunle Street, Abule Onigbagbo, Ikeja, Lagos, Nigeria. It's also available at Havila Health Haven Limited at Alausa Shopping Mall, Obafemi Awolowo Way, Ikeja, Lagos, Nigeria. And I believe the easiest way for most people would be to buy it on Amazon.com. Defeating Diabetes. Just put in Tony Akinyemi and that title, I believe, will come up on Amazon.com search engine. So this series will be starting on that. Now let me say that we're going to be doing this in two major segments. There will be many episodes in each segment. In the first segment, we're going to be looking at the basics of diabetes and its complications. What I want to do is to help our viewers to get to understand this menace called diabetes. Many people, I have found out, don't have the basic understanding of diabetes. They don't even know what diabetes is properly. They don't have a proper understanding of it. And so that informs why they treat diabetes with kids' gloves. So when you understand diabetes, you understand what it is, you understand how it happens, the risk factors, the causes, and the complications that it can give rise to. If you don't address it properly, then maybe that will help to position each one of us to be willing to take the necessary steps and actions required, first to prevent it if you don't have it, and then for those who already have it, to start putting measures in place to reverse it, or at the very least, to control it. All right, so part one will be dealing with the basics of diabetes and its complications. And then in part two, we're going to be proposing remedies, natural remedies, on how to defeat diabetes naturally. All right. Now, let me begin by talking about the two major kinds of diabetes. I'm not talking about the subsets of each kind. I'm talking about the two major kinds. Many of us are familiar with one of the two kinds. They probably have never heard about the second kind. And in this series, we're going to be laying it on the table. I'm not going to be going too deep into the first kind because it's not that common and it's not that popular. But I'll spend a lot of time and a lot of episodes on the second kind. Okay, the first kind is diabetes insipidus. Diabetes insipidus. And the second kind is diabetes mellitus. I'm sure many of you have heard about diabetes mellitus. We'll be talking more about diabetes mellitus because that is the one that is most common everywhere. Almost everyone you know dealing with diabetes is probably dealing with diabetes mellitus. But diabetes insipidus is another kind that is also out there. So I just want to give you a little insight, a little understanding about the first kind, which is diabetes insipidus. So what is diabetes insipidus? It is a rare disorder that causes the body to make too much urine. While most people make just about 1 to 2 liters of urine per day, people that are suffering from diabetes insipidus can make up to 19 liters of urine a day. And they suffer what we call polyuria. Polyuria means the need to urinate frequently. Of course, there are many other conditions that can make people to urinate frequently. Men who are suffering from prostate disorder can also experience polyuria. Poly means many, and urea means urinating. So polyuria means frequent urination or urinating many times through the day, maybe every 30 minutes, every 1 hour. The individual gets up to go to the bathroom to urinate. That's called polyuria. Prostate disorders, prostate enlargement, prostate cancer can also cause polyuria. Diabetes mellitus can also cause polyuria. Sometimes urinary tract infections, kidney infections, bladder infections can also lead to polyuria. But then, diabetes insipidus particularly causes a lot of frequent urination. That's polyuria. All right. So, it's important for us to understand what this is. Now, diabetes insipidus has certain symptoms that we need to acquaint ourselves with. There are certain symptoms that are, more noticeable in adults that are suffering from diabetes insipidus, and there are others that are common among children that are suffering from diabetes insipidus. Now, for adults, the signs and symptoms of diabetes insipidus include, number 1, being extremely thirsty. Of course, that is also common to diabetes mellitus. But the reason people become extremely thirsty is because they are urinating a lot. And so they are losing water and they are becoming dehydrated. So thirst, extreme thirst will come in. And they have to keep drinking fluid all the time. Second symptom in adults is producing large amounts of pale urine. And the third is frequently needing to get up to urinate, particularly during the night. And you find that people who are experiencing diabetes insipidus also almost always prefer very cold drinks. They almost can't, enjoy or tolerate water at room temperature. They want it very cold all the time because they feel extremely thirsty. These are the symptoms you find mostly in adults. Now, but for infants and young children, when they suffer from diabetes insipidus, they may have the following signs and symptoms. Number 1 is when they still wear diapers, you find out that they have very heavy, wet diapers. Such children and infants also bedwet, okay? And sometimes they have a lot of trouble sleeping. They feel so irritated, they can't sleep. Sometimes they develop fever because, when children urinate and wee on themselves over and over and over, they can get easily infected, and the infection then provokes a fever, high temperature. Their body becomes very warm. They can also experience vomiting, sometimes constipation. Such children and infants don't grow up properly, so they experience delayed growth. And quite often also, this is accompanied by extreme weight loss. The next question is, what causes diabetes insipidus? Now, diabetes insipidus occurs when the body cannot properly balance the body's fluid levels, and by implication, the electrolyte levels also in body fluids. Now, our kidneys typically help us to filter the fluid portion of our blood in order to remove waste products from our blood. As we eat, digest our food, assimilate the nutrients, they go into the bloodstream, circulate around the body will take the nutrients from the blood, all the cells, all the tissues, all the glands, all the organs. They will take the nutrients from the bloodstream and utilize it. After the body has metabolized, the body has utilized the nutrients, there are waste products of metabolism. They are called metabolic waste. These waste products are also dumped back into the blood. And then the kidneys try to filter these waste products and remove them from the blood. Now, so the kidney filters the fluid portion of our blood to remove the waste products, and the majority of the fluid is returned to the bloodstream, while the waste products and only a small amount of the fluid is retained to constitute the waste products into what we call urine. Okay, so after the fluid portion of the blood has been filtered by the kidneys and all the waste products removed, part of the fluid is returned into the blood, and then a little bit of the fluid is retained to dissolve or to serve as the base where the waste products will be in the liquid form. So you have urea, you have creatinine, and you have other waste products that the kidneys have filtered, and they are formed into urine and stored in the bladder. Okay, so urine is excreted from the body after being temporarily stored in the bladder. Once you have a full bladder, then you feel pressed and you go to urinate. Okay, so when the body is, the kidneys filter the fluid from the blood, and it does not return the part that is supposed to return into the blood and flushes everything out. That is diabetes insipidus. We're going to go on a short break at this point, and when I come back, we will continue our discussion on the causes of diabetes insipidus. Don't go away. Hi, Tony Akinyemi is my name, and I've written about 20 books to date. More are in the offing. Out of the 20 published books, to my credit, 6 of them are on healthy living. And I want to recommend these resources to you, to access them either digitally online or to get your hard copies. For digital access, you can visit amazon.com or familabooks.com. And for physical copies, you can visit the Shepherd stores at 18 Shogunle Street, Abule Onigbagbo off Mobolaji Bankantoni Way, between Eko Hospital and Sheraton Hotel Ikeja, to obtain your copy. You can also contact the email address on the screen or the telephone number, or send a WhatsApp message, and you'll be guided as to where to get any of the copies. God bless you as you access these resources. They will inform you, and the information will help to transform your health and that of your family, as well as that of the people in your sphere of influence. God bless you, and thank you. Welcome back. This is Exposé with Tony Akinyemi, brought to you by the Shepherd's Flock International Church. We started a series today on defeating diabetes naturally. And I've started talking about 2 kinds of diabetes: diabetes insipidus and diabetes mellitus. Our major focus will be on diabetes mellitus, but that's the one that is very common out there. But I'm giving a little information about the other kind, diabetic insipidus. And now I'm looking at the causes of diabetes insipidus. Now, normally, the kidneys filter waste products from our blood, and part of the fluid that the kidneys filter is returned back into the bloodstream. A little bit of the fluid is retained to hold the waste products in the form of urine. That is stored in the bladder. And when the bladder is full, we feel pressed, and then we urinate it, we excrete it, we get rid of it from the body. All right. Now, there is a particular hormone that we produce in our bodies. It's called antidiuretic hormone, ADH, or vasopressin. That's the name of the hormone. When we sleep, antidiuretic hormones are released so that we don't form too much urine while sleeping. So we don't wake up too frequently and disrupt our sleep. Okay, that's why the hormone, antidiuretic hormone, is released while we are sleeping. But during the day, of course, it's very low so that we can form urine during the day and urinate properly. So, but when a person is suffering from diabetes insipidus, this hormone called antidiuretic hormone, ADH, or vasopressin, that is needed for the fluid that is filtered by the kidneys to go back into the bloodstream, when that hormone is either not being produced enough, or the effect of the hormone on the body is not being felt, then the person can suffer from diabetes insipidus. All right, so the hormone ADH is needed for the fluid that is filtered by the kidneys to go back into the bloodstream. And this antidiuretic hormone is made in the hypothalamus in the brain. And it is also stored in another gland in the brain called the pituitary gland. So the hypothalamus makes the hormone vasopressin, or ADH, or antidiuretic hormone, and it stores it in the pituitary gland. Now, so any condition that causes a deficiency of ADH, maybe something happens to the hypothalamus, and the hypothalamus gland in the brain is no longer producing enough of ADH, there will be a deficiency of this hormone. Or maybe the hypothalamus is actually producing the hormones, but then something is blocking the effect of the hormone on the body. Both conditions will result in the production of excess urine or polyuria, and that could be the reason for diabetes insipidus. Now, diuretic hormone, or when we call something a diuretic, what we are saying is that thing helps the body to form urine. That's why when people have hypertension, one of the drugs that doctors will normally prescribe is the category of drug that we refer to as diuretics. In other words, anything that makes you to form more urine. And there are certain fruits and vegetables that also exert diuretic effect on the body. For example, if you take cucumber, it has a diuretic effect on your body. If you take watermelon, it has a diuretic effect on your body. And there are pharmaceuticals like moduretic, for example, that are diuretic drugs. Now, those are needed to help those who are not forming urine well to form urine. But then, there's also a need to balance urine formation and regulate it so that it is not overdone. That is why the body also secretes another hormone called antidiuretic hormone, or vasopressin. So when there's a problem with the production of ADH, or there is a blockage of the effect of ADH on the body, then excess urine production takes place and the person begins to urinate a lot, which is called diabetes insipidus. Now, the major difference between diabetes insipidus and diabetes mellitus is that in diabetes mellitus, the individual also urinates excessively, but then there's a lot of sugar inside the urine. That's diabetes mellitus. That's why they call it sugar diabetes. But in diabetes insipidus, it's just urine. There's no sugar inside. The person is just formulating excess urine with no sugar present in the urine. That's a significant difference between diabetes mellitus and diabetes insipidus. Now, there is also the possibility of an autoimmune disorder affecting a person's body and causing diabetes insipidus. So sometimes there may be no obvious cause of diabetes insipidus. However, in some people, the disorder may be the result of an autoimmune reaction that causes the immune system of that individual to start damaging the cells in the hypothalamus that produce this antidiuretic hormone. Just like in diabetes mellitus type 1, the immune system attacks the specialized cells in the pancreas that produce insulin. Okay, those cells are called the islet cells of Langerhans, or they are called the beta cells, BETA. Okay, those are the specialized cells in the pancreas that produce insulin that the body uses to regulate sugar in the blood. Now, so when those cells in the pancreas that produce insulin are attacked by the immune system, that is an autoimmune disorder. The immune system no longer recognizes that those specialized cells are part of the body and they are not meant to be attacked, but it launches a friendly attack, friendly fire, so to speak, on those cells, and the body can no longer produce insulin. The person then suffers from what we call type 1 diabetes mellitus. But then in the same vein, in diabetes insipidus, which is caused by an autoimmune disorder, the immune system launches an attack against the special cells in the hypothalamus in the brain that produce ADH, or antidiuretic hormone, and so the person becomes deficient in ADH. So when the kidneys filter the waste products from the fluid part of the liquid part of, or the fluid part of the blood, the portion of the fluid that is supposed to be returned into the blood, back into the blood, is not returned, and everything is sent into the bladder. So the person keeps urinating and urinating, but there's no sugar in the urine in the case of diabetes insipidus, but the person gets extremely dehydrated. Now, there are 4 types of diabetes insipidus, 4 different types. The first type is called central diabetes insipidus. Now, this is caused by damage to the pituitary gland or the hypothalamus, maybe from surgery, or maybe a tumor developed in any of the glands, or maybe there is trauma to the head and there is head injury, or certain illnesses can actually cause central diabetes insipidus by affecting the usual production, storage, and release of antidiuretic hormones. Anything that affects the production of the hormone, that affects the storage of the hormone, and that affects the release of the hormone, or the effect of the hormone on the body, any of these can lead to diabetes insipidus. Now, an inherited genetic disease can also cause this particular condition called central diabetes insipidus, which is the first type of diabetes insipidus. The second type of diabetes insipidus is nephrogenic diabetes insipidus. Nephrogenic. When you hear the word nephro in medical parlance, it's in reference to the kidney. When you hear renal, it's in reference to the kidneys. Okay, so nephrogenic means that it has to do with the kidneys themselves having a defect and they are unable to do their job properly. Now, nephrogenic diabetes insipidus occurs when there's a defect in the structures in the kidneys. And now that defect in the structures now makes the kidneys unable to properly respond to the hormone, antidiuretic hormone, that makes part of the fluid to return into the blood. Now, the defect may be due to an inherited problem, which is usually, we call that genetic problem, or it could be a disorder or a chronic kidney disorder. Now, certain drugs such as lithium or certain antiviral medications, such as Foscavir, for example, can cause nephrogenic diabetes insipidus. So, if a person is experiencing diabetes insipidus, one of the very first steps to take is to evaluate all the medications that person may be taking. Read all the fine prints in the insert and check whether one of the side effects documented is diabetes insipidus or any effect or interference with the work of the ADH hormone. The third type of diabetes insipidus is gestational diabetes insipidus. Now, gestational diabetes insipidus is very rare, not very, very uncommon. It occurs only during pregnancy and only in women, okay, because it's women that get pregnant, by the way. So it happens when an enzyme that is made by the placenta, when a woman is pregnant, the placenta can produce it produces certain enzymes. Now, one of the enzymes produced by the placenta can begin to destroy the antidiuretic hormone in the mother. And so when that enzyme from the placenta of a pregnant woman begins to damage or destroy the antidiuretic hormone, then that hormone can no longer exert its effect in water uptake back into the blood. And so that woman during pregnancy now begins to experience diabetes insipidus. Quite often, when that woman delivers the baby and the placenta is out, that enzyme that the placenta produces is no longer there. And so the woman can return to normal again. That's the third type of diabetes insipidus. Now, the fourth type of diabetes insipidus is called Dispogenic Diabetes insipidus or primary polydipsia. Dispogenic diabetes insipidus or primary polydipsia. Now, this condition can cause production of large amounts of diluted urine from drinking excessive amounts of fluids. It can also be caused by damage to the particular mechanism that regulates thirst in the hypothalamus. It's called the thirst regulating mechanism. When there's a damage to that in the hypothalamus, that condition has also been linked to various other mental illnesses such as schizophrenia, for example. All right? I believe that you've been well informed and educated regarding the two kinds of diabetes, diabetes insipidus and diabetes mellitus. We have spent this first episode to give basic information regarding diabetes insipidus, which many people may not have been familiar with. From the next episode, we are going to zero in on the main crux of the matter, which is diabetes mellitus. I want you to tell all your friends, tell all your neighbors, tell all your colleagues, tell all your relatives, tell all your enemies that there is a series on Exposé going on right now on defeating diabetes naturally. I dare say by the special grace of God that most cases, probably 90% of diabetes cases, can be reversed through food and faith therapy. Again, if you have not done so, please click on that subscription button. Subscribe to our channel if you're on YouTube. And if you're on Facebook, just like us on Facebook. All right? And click on the notification bell as well if you're on YouTube so that you can be alerted and reminded whenever we come live on Exposé. Thank you and have a very beautiful week ahead of you. God bless you. Hi, Tony Akinyemi is my name, and I've written about 20 books to date. More are in the offing. Out of the 20 published books, to my credit, 6 of them are on healthy living. And I want to recommend these resources to you, to access them either digitally online or to get your hard copies. For digital access, you can visit amazon.com or familabooks.com. And for physical copies, you can visit the Shepherd stores at 18 Shogunle Street, Abule Onigbagbo off Mobolaji Bankantoni Way between Eko Hospital and Sheraton Hotel Ikeja to obtain your copy. You can also contact the email address on the screen or the telephone number or send a WhatsApp message and you'll be guided as to where to get any of the copies. God bless you as you access these resources. They will inform you and the information will help to transform your health and that of your family as well as that of the people in your sphere of influence. God bless you and thank you.